Hello, my name is Dr. Charles Flowers. I'm currently a clinical associate professor of ophthalmology at the USC Roski Eye Institute at the Keck School of Medicine here in Los Angeles. I am the director of the Sports Vision Training and Visual Rehab Center at USC Roski Eye Institute, and I've been using the SmartFit unit for the last year. Primarily looking at it as a really useful device for concussion rehab as well as sports vision performance enhancement. One of my major uses for this device has been using it in concussion rehab, primarily in patients who've had post-concussion syndrome. These patients have had concussion symptoms for more than 3 weeks, and they've had a number of different symptoms and they haven't been able to resolve them. I've been able to get these patients on the SmartFit unit, and within about 2 to 3 weeks of being on the SmartFit unit, get most of their symptoms to be completely resolved. I see this as a valuable tool for concussion rehab because currently the current mantra with respect to concussion rehab is that patients rest and rest, and we know that that's not the way to go these days. My personal feeling is that every patient should undergo visual training rehab within about a week of their concussion, and I really believe that because this is how I feel the brain can be rehabbed. Just like if you have an injury to your knee or to your ankle, you rest and then you begin to go into the weight room and you start exercising that muscle to rehab it and re-strengthen it. Well, how do you do that with the brain? Well, you re-strengthen and rehab the brain by activating visual networks in the brain. I do truly believe that this is a great tool for concussion rehabilitation, so we're going to do a randomized study where we take a control group and a treatment group, and we're going to look at the recovery from concussion in the two groups. So we're going to have a control group that doesn't undergo SmartFit training, and then we're going to take a treatment group that undergoes SmartFit training after concussion. We're going to see if the control group, see which group gets better faster in terms of symptoms, recovery back to normal function, things like that. So those are the studies I'm looking at doing with this unit, and I think that we're going to find some really positive results. So we got some exciting things coming out with this unit in the next couple of years.